Welcome to this episode of the Partovi Effect. My name is Mrs. Madi Partovi.
And I'm Dr. Ryan Partovi. So, underreporting inflated fatality matrix. So, some commonly cited measles statistics can be misleading if you don't consider the context. For example, public health agencies often state that measles has a fatality rate of about 1 in 1,000 cases. But this number is derived from reported cases, which I've mentioned before, vastly undercount total infections. So, in the pre-vaccine era, nearly every child got measles. I'm going to repeat that again. In the pre-vaccine era, nearly every child got measles. And guess what? In the post-vaccine era, every child is getting exposed to measles at some point, whether they realize it or not. More on that in a minute. But yet only a fraction of cases were officially reported. Most mild cases never saw a doctor. The CDC has noted that in the early 60s, pre-vaccine, there were 3.5 to 5 million measles cases annually in the United States, despite only 400 to 500,000 being reported. This 85 to 90% underreporting means that the true infection fatality rate is much lower than the one in 100,000. So this is history of measles from the National Vaccine Information Center, okay? But using CDC's own data. Independent epidemiologists point out that using reported cases, usually the more severe instances, inflates the apparent deadliness of measles, which then overblows the risk in healthy populations. Indeed, when considering all infections, including the mild or subclinical cases, which means subclinical just means not bad enough that you would ever go to a doctor, maybe you sneezed a few times and had one dot appear on your arm or something, the fatality rate of the 1950s was closer to 1 in several thousand or fewer, a point that's often glossed over in the pro-vaccine literature. So this selective emphasis and the agenda, so there's an argument here that measles risks have been emphasized in the alarmist terms to sell vaccines. And I specifically asked the ChatGPT deep research tool to evaluate the likelihood of this, because that's one of the concerns I have as a naturopathic physician, as somebody who is always about following the money and trying to understand what are the perverse incentives, what are the hidden motivations of these different actors, to understand why the recommendations that get made. I think we have to look at that. So vaccination, undeniable benefits in reducing measles cases, which is to say the ones that get reported to the doctor. I think we would all agree that the measles vaccine is reducing the total number of cases, which is to say the severe infections that would cause somebody to go to the doctor. The literature shows that dramatic mortality reduction, so reduction in death, predated the vaccine, as we've talked about. So researchers, historians note that public health messaging often fails. I'm going to say, it says sometimes, I'm going to say often, fails to clarify improved outcomes were largely due to better nutrition and healthcare instead of attributing all progress to vaccines. There's a definite shift of, okay, we're not going to talk about, if you look at the pre-1963 research, it's all, oh, we're doing such a good job with nutrition and hygiene and all these things. And then post-1963, it's, oh my God, what an amazing vaccine that we have. The trend was already there in terms of mortality reduction. The selective emphasis can create bias. Independent analyses free from pharmaceutical or political interest underscore that by the time the vaccine was introduced, measles was causing far fewer deaths in developed countries than the decades prior. And this is directly from CDC. The National Vaccine Information Center, which is an independent consumer-run organization, compiled all this data showing that U.S. measles mortality has fallen by 98% between 1915 and 1955, long before vaccines. Data-driven reviews, often criticized by mainstream experts that are drawing because they're drawing from historical records, often reach different conclusions than these industry-funded studies. So we're in this review prioritizing the peer-reviewed research, epidemiological data from independent public sources, not from big pharma. So we're looking at historical vital statistics, academic cohort studies, excluding studies with clear conflict of interest. I specifically asked it to do that. So anything funded by vaccine manufacturers, authored by individuals with pharmaceutical industry ties, we just said we're not going to include those. We're only going to look at the data that is as unbiased as possible. So CDC's historical mortality reports and the neutral epidemiological analyses, for example, the Cambridge University study on measles mortality trends, which it links here. These sources do not have the incentive to exaggerate measles outcomes from the vaccine, and by focusing on that, we're finding that measles dangers in well-resourced settings, which is to say people who have good health care, were much lower than often portrayed. Yes, it can cause complications. We don't want to dismiss real suffering, or as you pointed out, the 2 people who have died. I'm not minimizing that in any way, but all things have risks and there are trade-offs in all things. And that's going to be the emphasis as we move forward. The risk of severe illness or death for a healthy child. Now, not somebody who's got 3 different complications and other that's obese and has an autoimmune condition or some sort of immunodeficiency and maybe leukemia, right? Like that's not who we're talking about here. We're talking about the risk of severe illness or death in a healthy child was comparatively very small by the mid-20th century prior to the vaccine. And that context is truly crucial when you were assessing all the claims made in the vaccine promotion campaigns. Now, that's the second piece. We've talked about the bias in the way that this gets talked about and reported. Okay, once again, I've been Dr. Ryan Partovi. I am Dr. Ryan Partovi, and I will continue, hopefully, to be, God willing, Dr. Ryan Partovi.
And again, I am Mrs. Madi Partovi, and this is the Partovi Effect, creating the consensus.